Tell your mom, tell your dad, tell your auntie, tell everybody.
Yes.
Tune in.
Yes.
Thank you so much for watching That Pharmacist Show. I am a community pharmacist and I've been practicing for 2 years. I currently work in a community health center pharmacy, and with me I have...
Hello, I am Dr. Shanita. I've been practicing for about 3 years now, and I currently work in the pharmaceutical industry.
Hey, I'm Dr. Tiff. I've been currently practicing in pharmacy for 2 years. My career path started as a retail pharmacist. I am currently transitioning into hospital pharmacy. And
I am Dr. Q. I am currently practicing as an educator for pharmacy technology students. So I'm educating the next generation of pharmacy technicians. I've also practiced in multiple settings for 11 years. But have transitioned also into the Office of Diversity, Equity, Inclusion, where I get to be in the space of helping healthcare leaders understand the purpose and intention of diversity, equity, and inclusion. So today we are going to share a lot of information with you about pharmacy and the impact that it has on you. But before we go into current trends and things that happen in the pharmacy, we want to kind of break down for you what's the difference between a pharmacy and a pharmacist and a pharmacy technician. We're going to talk about the education around being a technician versus a pharmacist. We'll also talk about a little bit of the services that all the pharmacies offer for our customers and patients like you. So keep watching.
Yes, but before we jump into the roles of the pharmacist, we thought it would be a good idea to first give a little bit of background information about our education and training. So from my experience, it seems that many people are unaware that pharmacists are doctors. How do y'all feel about that?
That's true.
Same situation?
Yeah. I will tell you, the only time someone calls me a doctor is when they're calling to ask me for money. For that annual phone-a-thon. Dr. Johnson, and I know they want some money then.
Yes. So now, prior to the early 2000s, most pharmacists, well, all pharmacists did obtain a Bachelor's of Science degree in pharmacy. However, in the early 2000s, it was mandated that the Doctorate of Pharmacy degree would become the entry-level degree for practicing pharmacists. Mm-hmm. So any pharmacists that graduated after 2004 are considered to be doctors, and they will have the credentials Pharm D behind them. Now, as far as our education goes, we each obtain a 4-year degree, undergraduate degree. Then after obtaining our Bachelor's of Science in various concentrations, we then transition into the pharmacy curriculum program.
You're saying that you got to do a lot of math?
Yes.
Oh yes, there was a whole lot of math, a lot of chemistry, but the chemistry was actually fun. I enjoyed that. Now, undergrad, the organic chemistry was not a fan, but once we started with medicinal chemistry, I really enjoyed that subject.
Yeah.
But so it was 3 years of sitting in class all day, learning about pharmacy.
And learning about how the medications work in the body,
mm-hmm.
and how what the body does to the drug when it is being metabolized or being processed.
Yes. Then we transitioned into doing 1 year of hands-on clinical training in various pharmacy settings.
For free. Let them know it's for free. Actually, we paid for it.
Yeah, we paid to work.
Yeah,
for free. For free.
It was a long year, however, it was very rewarding.
Mm-hmm.
I came out feeling so confident to start my pharmacy career. So once we wrapped up our on-hands training, we then had to sit for a board exam. And this board exam consisted of 2 different parts. So the first part pretty much tested our knowledge. Our second part evaluated our knowledge as far as state and federal pharmacy laws goes. Mm-hmm. Once we passed our board exam, we then were awarded a state license to practice in North Carolina, and then we began our careers as a pharmacist.
Did any of you all do residency programs?
I did not.
No, I did not.
Okay.
Unfortunately, I didn't match. And that's just being real.
That's okay.
It's okay. I did do 2 residency programs actually. So So with the residency programs, it's postgraduate training that you can have or not have. It's really your choice. But at this point of graduate pharmacy school, most people do need to do a residency program just for you to have that career mobility. So I did 1 year in acute care, and then I also did a year as a hospital pharmacy administration.
What's acute care?
Oh, acute care. Good question. So acute care is a hospital setting. That's what acute care stands for, pretty much.
Now I want to share some pharmacy services with you that you may not be aware of. So one of the first services, and pharmacy services are going to vary from pharmacy to pharmacy. And the first service that I'm going to talk about is basically a medication review, a comprehensive medication review, where you have to make an appointment. Well, you don't have to, but you can make an appointment with your local pharmacist, and they will sit down and talk to you about all your medications, prescription and over-the-counter, herbal supplements, vitamins, and they will go over with you how all the medications work and side effects that you should be aware of. And they will also share pertinent notes from this visit with your healthcare provider so they can make better informed decisions with you regarding your health. Another service, so nowadays a lot of liquid medications that are available on the market, prescription or over the counter, already come with a flavor. But sometimes your child or the person may not like the flavor. So now pharmacies offer flavoring, and you may have to pay a fee for that. Then another service that the pharmacies offer would include med packing. So pharmacies can package your medications to help you really get on track and stay on track, and then it will be in different sections based on the day and time of day. So morning, breakfast, noon, and if it wasn't already evident, hopefully during this whole pandemic situation, you realize that your local pharmacy can provide vaccinations. So pharmacists and now pharmacy technicians as of 2020 provide vaccinations to you or for you. So those are just some of the services. And if you're wondering, does my local pharmacy provide a service? You can definitely check on their website or social media, or you can just stop by and have a conversation with the staff, and they can inform you whether or not they provide those services. So when y'all at your practices, what services are y'all offering?
So when I was practicing in retail pharmacy, one of the services that we offered was blood pressure screenings as well as blood sugar screenings. And now the blood sugar screening may not always be free depending on where you go.
And this happened in the pharmacy setting?
In the pharmacy, yes.
While you're trying to check and verify prescriptions?
Oh yes. We wear many hats. So yes, there were definitely times where I had to step out, check someone's blood pressure, educate them on how to manage their blood pressure, give any type of recommendations, or if there were some situations where I had to refer them to an urgent care or an ER. So it's very, amazing that we're able to be very accessible to patients so they can come to us and we can vastly identify any type of concerning conditions that need to be addressed by a doctor or their healthcare professional.
So we've often been called the most trusted healthcare worker because, we're on literally almost every corner, right? So, but all these services that you all are talking about, are they going to be offered at your regular mainstream retail pharmacies, or do I need to find an independent pharmacy to do it? And it's a real question for me because I haven't done these type of services in quite a while because I've been in the hospital setting for so long.
You definitely can go to either or. So you can go to an independent pharmacy, which is usually called like a mom and pop type of pharmacy, or you can go to one of the big chain pharmacies and be able to access these types of services.
Yeah.
Absolutely. I was going to say, in addition to that, when you talk about counseling, because that is what we're very good at doing. Generally, you can walk into your local retail or your local independent pharmacy, and we can talk to you about over-the-counter drugs as well.
Tiff, I think you bring up a good point talking about over-the-counter drugs, because I think a lot of people are confused and think that if you buy something over-the-counter, that means it's safer. But that doesn't necessarily mean that. And just because you open up a bottle of pills, if it tells you to take one, you should really take one. You don't need to take two. So I know I've had this conversation, I don't know about you all, but we become then the drug experts for the family because everybody calls you, right, and wants to know, well, tell me about this drug. And actually, I've told my parents, don't take a drug unless you consult me first because we do 4 years of medication knowledge, and a medical doctor does a semester. So we really are the drug experts.
Not to down our medical doctors in any way. That's not what we're saying.
Absolutely not. But we serve to catch things for the medical doctor so that we make sure that drug is appropriate for the patient. But I think one of the things that people forget is that, or not really know much about, is the fact that just because a dose is 5 milligrams and another dose is 500 milligrams, it doesn't mean the 5 milligram dose can't kill you.
Correct.
You know, you could take 1,000 milligrams of one drug and be okay. Say ibuprofen, you take 1,000 milligrams, you're gonna be okay. But you take 5 milligrams of warfarin, it's a completely different outcome that you could have, right? And so I think that is something to make people aware of, that over the counter doesn't mean safer.
But I do like to encourage patients on my social media to just ask your local pharmacist, because there is so much information about medications and drugs and their actions that the average person does not know of. But if you can just chat with your local pharmacist, get to know them, they can catch a lot of potential problems and correct it before it even becomes an issue.
I was going to say, that just made me think that Google necessarily is not always your best friend when it comes down to medications and searching medications. It can provide some information, but not all of the information out there is accurate information.
Gotcha.
Yes, you can definitely use, if you want to look at Google, use it as a discussion topic and take that information and talk to your local pharmacist or your healthcare provider about it to clarify.
I agree. There's nothing wrong with trying to be informed.
Exactly. Now, Dr. Tiffany, can you tell us a little bit more about
medication review?
Yes.
So, a part of the many hats that we wear that Shamita was talking about during picking up the phones for doctors, doing transfers in a retail setting, we have to do something called a medication review.
Now, this is not the same medication review that I was talking about by appointment.
So another terminology for it is called a drug utilization review, to be more specific. That's the medical terminology for it. And what that entails is us as pharmacists looking at the current drugs that you're taking, looking to see if there are any duplicate therapies, meaning maybe you may be on too many drugs for your medical condition, seeing if you have any possible adverse events for new prescriptions that might be coming in. And adverse events means just what it means, something that is going to affect you negatively. So when I think of drug utilization review, I think of medication with medication interactions, drug disease states with medication reactions.
Now, can you talk a little bit more about that? Because some medications can cause issues or cause flare-ups with other health conditions. So how important is that, Dr. Tiff?
So I can think of one in particular. Everybody knows about prednisone, it's a type of steroid, right?
Yes.
So if you are diabetic or have diabetes per se, and take prednisone, which nowadays is COVID, with pneumonia, with having the flu, or I should say any type of upper respiratory, we tend to get what's called a dose pack. That should be a familiar term for most of us. Somebody with diabetes, that can actually increase your blood glucose. That can actually increase your blood glucose, your blood sugar. In addition to that, if you have hypertension, which is high blood pressure, it can also increase your blood pressure. So it's very important, when you get certain drugs, that you might want to ask those questions. How will this affect my disease state? Some people don't realize things are being thrown out of whack with the new things that are being added to their regimen, their drug regimen. And then there's some things that you might not necessarily need. It might have been good for the moment when you were taking it. Your disease state could have either gotten better or worse. And those drugs can actually make things worse for you. And not, you don't need what I call a cocktail party all the time.
Yes, and you know what, Dr. Tiff? This can happen with over-the-counter medications. There are certain over-the-counter medications, y'all, that can cause certain health conditions to flare up. And we're not going to go into details because we want you all to just ask your local pharmacist.
And that might be a topic for future. If you guys,
Interested in
if you guys are interested, whatever topics you're interested in discussing, we can go into that in more detail if you're interested. We don't want to bore you.
Yes, but definitely over-the-counter meds and herbal supplements, natural vitamins, they may cause certain health conditions to flare up. But what else goes into the this medication review?
So we talked about drug-drug interactions. We talked about drug and disease state.
What about allergies? Is that
Yeah, there we go. Allergies goes into this review as well. We look at your allergies. As a matter of fact, a common drug out there, if I wanted to think off the top of my head, Percocet, people use it for pain. Some people have morphine and codeine allergies, and people don't realize like things like Norco, which is hydrocodone, and oxycodone. Those are codeine related drugs, and I don't want to get too technical.
Yeah.
I don't want to get too technical. But there's certain we call something called anaphylactic reactions. That is swelling of the tongue, swelling of the throat, swelling of the face. If we notice that there's a drug that you're on that might cause that, and there is a cousin drug to that you're being dispensed, those are things we want to flag your doctor about. So, why is my medication taking so long?
Yeah.
Sometimes is a common aggravation, I would say, with the patient. And there's a lot that comes into play when we talk about making sure that things don't kill you. And so you might want to consider that,
Well, I mean, I think that's a good point and a good segue into us talking about what is it that a pharmacist actually does, right? Because when you walk into a pharmacy and you see the pharmacist nose down, just working, and then you see other people frantically walking around doing other things like picking up the phone, taking prescriptions, checking people out. That's usually a technician that you're talking to there. But what does the pharmacist actually do? And I think that's important for us to talk about as well. Because while you're talking about that drug utilization review, actually sitting down with the patient and doing a med review, but there's a drug utilization review that goes on for every prescription that comes through the door. So every single prescription, a pharmacist is looking at not just the rudimentary demographic information, but also looking at what other medications are you taking. Potentially, is this the right medication for your age? Is this the right medication? Like she said, does you have any allergies? Maybe you're 80 some years old. You might have decreased kidney function. This might not be the best medication for you. So all of those things go into play when a pharmacist is looking at your prescription that the doctor has prescribed for you. And if any of those things don't sound quite right, then we have to stop it. Yeah. And we have to call the provider, and we have to try and see, and ask the provider, maybe would you potentially consider all these buzzwords we have to use to say, hey, would you consider putting Mrs. Smith on drug B instead of drug A, and here's why, right? And so we are really that gatekeeper to make sure that you are getting the right medication.
Yeah, I was going to say that also made me think of people being on different, having different pharmacies.
Yes.
And doctors potentially not knowing that, this patient's on this drug because this provider had prescribed it, and kind of keeping that, what they call that interprofessional communication between providers and nurses.
Yeah. Well, we got a lot of mid-level providers now that can prescribe, right?
Yep. Yes, and when you say mid-level,
yes,
what are you?
So when I say mid-level, that's a good question. So when I say mid-level, I'm thinking, physician assistants are mid-level. We've got nurse practitioners. Who else can prescribe? Besides
the clinical pharmacist practitioner.
The clinical pharmacist practitioner, of course, and you all are a lot more knowledgeable about that that area. Why don't you tell them a little bit about the clinical pharmacist practitioner?
And I was going to say that's not necessarily mid-level. It's kind of in between mid-level, but that's another discussion. In between mid-level and high level. But go ahead.
Okay. Well, since we are talking a little bit more about pharmacists now. Dr. Q, can you tell us the difference between, or tell our audience, because we know the difference between the pharmacist and the pharmacy technician? Who is the first person that the person will come to, that the person sees when they come to the pharmacy?
Well, if the pharmacy is fully staffed, it should be the pharmacy technician. And that's a whole nother episode.
I was about to say.
That's another episode for another time. But so a pharmacy technician really is the heartbeat of the pharmacy. Really,
Yes,
quite frankly, I
absolutely.
tell everybody a pharmacy is only as good as the pharmacy technician staff that you have. So our technicians, they're the ones that are going to greet you first. They're usually going to be at the end window or the inbox where you drop off your prescription. Whether you come in the door or you go to the drive-thru, it's the technician that takes that prescription. They're usually the ones that's entering it into the computer for you, checking you out. Now, the difference between a technician and a pharmacist educational level is the fact that a pharmacy technician, they can do something as simple as going through an 8-week crash course, which is one thing that I teach at one of the community colleges, or they can get a diploma in 1 year, and then the highest is getting an associate's degree that takes about 2 years to get. So right out of high school, you can go and get a 2-year associate's degree in pharmacy technology, and that puts you at the top of the pay scale as a technician. And so because a technician has not done the 4 years of doctorate level training, they're not able to provide consultations. They can't actually tell you more information about your drug other than what's actually on the prescription and what's on the bottle. So when they ask you to step over to that consultation window, or they ask, do you want to speak to a pharmacist, that's why they're asking you that. Now, they can certainly point you in the right direction of an OTC item, come from behind the counter and tell you where you can find that, but they're not legally allowed to say, well, drug B is better than drug A for your specific condition. And that's really that difference. But I will say that now we're moving towards technician practicing at a higher level. So I'm really excited about the fact that because of COVID, technicians now are able to immunize. And they've been able to immunize in some states before, but now they're able to immunize under our Emergency Act. All technicians in all states actually can immunize if the state is, able to allow for that. So we've actually, myself and Dr. Tiff, right? You've been teaching the courses so that technicians are actually certified now to give immunizations. And so they're able to be deployed now in the retail setting, as well as some of these clinics that are giving out the COVID-19 vaccine.
And Dr. Q, it was actually a pharmacy technician that gave me my second dose of the COVID-19.
Okay.
COVID-19.
Yes.
I was really impressed at her technique.
Mhm.
Yes, I was really impressed. But we are all fully vaccinated.
Yes.
And that's going to be a topic for a future show. But yeah,
For sure.
everybody got their dose too, right?
Yes.
What'd you
yes.
get?
I have Pfizer, the top shelf.
Moderna.
Pfizer.
Okay.
So not that there's any difference, but I mean, it's a choice.
Yes.
Like I said, that's for a future show.
For me, I feel whichever one is available, definitely jump on it and try to receive that vaccination, whether it's the
Yes.
Moderna or the Pfizer.
Yeah.
Yes, or the
The
Johnson and Johnson.
and the Janssen one.
Yeah.
Yes.
So when it comes to these, the technicians administering the vaccines, do you support this or?
Absolutely. I absolutely support it. Our technicians are very, very capable. A lot of technicians actually started out wanting to go to pharmacy school, and then for some reason they decided not to pursue a PharmD. But they're absolutely capable of giving vaccinations. They're capable of doing most of the work that we do. Actually, they are. They just don't legally. They can't
trained,
do it.
if they're trained, and if they are qualified. But yes, I think sometimes we take for granted the qualified and trained technicians.
Okay.
But I definitely support them if they're trained and qualified.
Yes, yes. Now, when you say trained and qualified, unpack that, because we may have some technicians watching. I'm sure we will have some technicians watching. So, what is trained and qualified?
Technician can really, how it is right now, the technician can really start working in the pharmacy with no previous experience.
Mm-hmm.
They really can.
They can.
They can. But according to the North Carolina Board of Pharmacy, after so many days, you are expected, the pharmacy technician is expected to receive that training. Now, is every pharmacy in the state of North Carolina adhering to that? That's a topic for another day. So that's what I mean when I say training. And then
Gotcha.
qualified, not only can you go through educational steps that you talked about, Dr. Q, but you
Yeah.
can also get your certification.
Absolutely.
So, and now they
Can
have
and
different certifications from my understanding. Is that correct?
Yes, yeah.
For
The
the
pharmacy technician certification board has different levels of certification, but you want to start out with your national certification. That's really your ticket into the hospital or another clinic setting. For sure, at retail, you can walk in the door and not have any experience.
Yeah.
Yes.
And I wanted to say, we didn't talk about technicians in a hospital setting. We can't forget about them. We talked about the in window and the out window.
Yes.
Your technicians in the hospital settings are the ones that run all those medications up to the floor.
Yeah.
To make sure that the nurses are able to come bedside and give you what you need. They draw up those IVs to make sure that you're getting taken care of in a hospital setting. I mean, there's a whole plethora of things that they can do outside of retail pharmacy.
Were any of you technicians prior to becoming pharmacists?
Yes,
Yeah,
I was.
I was.
Many years. I was. I think about 10 years before I started pharmacy.
Really? Wow.
Yes, so I know what it's like, and I have a certain level of expectation for the techs that I work with, because I was a tech before.
Yes.
So,
I was gonna say I definitely can agree with you on that. I know what it's like and for me, being a pharmacist, especially working in both the retail and now hospital setting, it's kudos to technicians as well. I take pride in ensuring that they get the training and also that they get the support that they need, because they support us a lot.
The takeaway from this, between the pharmacists and the pharmacy technicians, that I think is important to know is that when you call the pharmacy, the technician can help you with a lot of things. And really the only time that you probably need to speak to the pharmacist
Smiling.
really the only time that you probably should speak to the pharmacist is if you had a drug related question, maybe something going on with your health and you're really not sure. Then that's when it would definitely be appropriate to ask for the pharmacist. But as far as you just want to get your prescription filled, you want to know how many refills you have left, the technician is definitely qualified to assist you with that information.
Yes.
So that would be one of the main takeaways.
Yes.
What do y'all, how y'all?
Sound like a pet peeve to me.
Definitely.
Nah, I'm joking.
Yes, it is.
Well, I think you're encroaching into a point that I think we definitely need to have on a future show of what does that process look like when you come and drop off a prescription, because I know a lot of times you show up and it's not ready. And I liken now pharmacies to really kind of like how restaurants are these days right now. Like, things have kind of shifted in that since we're in this COVID era, you can pull into a restaurant and you go in and it's not many people sitting in the booth. But yeah, it takes forever for you to get your food now. And it's because they've got a lot of call-in orders. They have a lot of people that are coming to pick up their order, curbside or through drive-through. And so that's kind of how a pharmacy is. You may walk in there and there's only 2 patients that are standing in line, but there are 300 prescriptions that need to be done in the next 2 hours,
Yes.
And so we do want to give you some information on what does that process look like. And that'll be a future episode, as well as taking you on that journey of, I dropped off my prescription, what are all the steps that it has to go through before it actually gets in my hand, because it's not as simple as some people think. We're just pulling a bottle off the shelf and counting some pills and sticking them in there and then slapping a label on it. There's so much more behind the scenes that happens in a pharmacy for you to actually leave with that drug in hand.
And make sure it's safe for you.
Yes.
Yeah, so there's so many different topics that we are looking forward to discuss. We'd also like to hear some feedback from you all. So could you please drop down in our comments and just leave some topics that you're interested in us discussing in the near future.
Yep. And also, don't forget, like, comment, share, subscribe.
Okay, so we would like to thank the young lady who helped design our logos. And we would also like to thank the company that actually made our t-shirts. So if you're watching Tay and Yellow Crayon, we appreciate you so much.
Thank you so much. So in talking about that, we had some questions on our social media and in our inbox if we'll be selling these shirts in the future. It's something that we're looking to do. However, we do have a few that we plan on giving away in a giveaway. And you'll have to look in our social media, and that's our Instagram. That is at That Pharmacist Show. Instagram, check our Instagram out, look in the stories, look in the videos. You'll find out further how to what they say, how to copy one of these.
Our merch.
and any other ideas that you might have. You know, we got mugs, you know, anything you can possibly think of. We put our logo on there for you.
Yeah.
And we all wanted to wish you all that celebrate June 19th. We want
Happy
to wish you a
Juneteenth.
Happy Juneteenth.
Happy Juneteenth.
Yes.
Woo!
And I think I'm going to say that even though it's called That Pharmacist Show, this show is really about you all. So we want to provide for you whatever you want to hear. So please do put it in the comments. Let us know what you want to hear from us.